So we want to work on being able to side these bones. Do they come from left or right? And so to be able to properly side a bone, you need to know a medial or lateral marker, an anterior or posterior marker, and a superior or inferior marker, so that you know the directionality of the bones. So if you know at least one of each of those, then you can figure it out. So with the humerus, this one is pretty easy. So we know that the trochleate capitulum, you can think of it as a bubble and a bow tie if you want to, always point anterior. So there's our anterior marker. We know that the head always points medially because it has to touch the scapula. And the olecranon fossa, this big triangular dip, is always on the posterior side. So taking that into consideration, we know that this is medial, that this is anterior, and this is posterior, that this has to be a left humerus. With the ulna, it's a little bit more difficult. So the ulna is always going to be on the medial side of the forearm. The radius is always going to be on the lateral side of the forearm in anatomical position. So we always know where one is in relation to the other. And we do know that there's a joint formed between these two, so there has to be a marking to tell me on the ulna where to look for the radius. So wherever you see the radial notch means it's the lateral side of the ulna. Trochlear notch is always going to point directly anterior. So if we know that, this one also has to be a left. The radius is a little tougher. We know that the proximal end has the golf tee head on it. The radial tuberosity is always going to point medially towards where the ulna is. And on our distal end, to get a grip on which is anterior and posterior, the smooth side will always point anterior. The rough and bumpy side is always on the posterior. So smooth side up, bump medial. Proximal end is the golf tee. This one also has to be a left radius.